In this webinar, you will hear from leading CVI experts share their on-the-ground experiences and insights on what communities should consider in order to effectively implement and sustain a CVI strategy. Before we launch into the substance of the webinar, I will note that this session is being recorded and it will be posted online at a later date. In addition, all presenter slides will be posted online when a recording is made available. Participants can also access closed captioning through the multimedia tab on the right side of your screen or by accessing the link and access code posted in the chat. Finally, we are interested in your feedback and insights on community violence interventions. In the chat box for this webinar, we will provide a link to a survey form. Your participation in this survey is optional and all responses will be anonymous. It is now my pleasure to introduce Clarence Wardell III, Senior Advisor for Policy and Implementation and Delivery in the White House Office of Domestic Policy Council. Mr. Wardell, the floor is yours.
Thank you, Theron. Thank you so much. And good afternoon, everyone. Sarah mentioned my name is Clarence Wardell, and I'm a Senior Advisor for Policy Implementation with the Domestic Policy Council, and also work with the White House American Rescue Plan Implementation Team, leading our work on data and equitable delivery across ARP programs. Just wanted to thank you all for being with us here today, and just touch a little bit on really the importance of this work and not just generally, but the importance of it within the administration strategy to reduce gun violence. And we firmly believe that a key pillar of that approach is scaling community violence intervention strategies that have shown promising results, but have been historically underinvested in. As many of you may know, we are seeking significant federal funding to help change that historic reality and really give these approaches the resources they need to take hold and have most impact possible in our communities. However, even as we push for that funding, there's both the need right now to think about scale and strengthening infrastructure, as well as an opportunity to do so, thanks in part to the resources made available through the American Rescue Plan state and local funds, as well as some of the new guidance that we announced earlier in the administration that makes funding available across existing federal programs. To that end, the President announced the 16-city Community Violence Intervention Collaborative in late June as part of his strategy that is a place-based effort alongside key partners focused on several goals, including to accelerate the establishment of and support for local CVI programs, increase funding and availability of cities, and the ability of cities and community-based organizations to access that funding for new and existing programs and strategies, and to ensure the programs are effective at decreasing gun violence and increasing community safety. And really, alongside the work that you all are in the discussion we're having today, is to establish sustainable infrastructure to support the growth and maturation of new and existing programs. This work is happening alongside federal partners such as Theron and the DOJ team, the White House, philanthropy, and longtime CVI leaders like several you'll hear from today that will be engaged in this work over the next 18 months. As a complement to that work, Theron and the team at DOJ has been running this wonderful webinar series to help elevate best practices and inform the work that many of you all are engaged in. Today's webinar participants are really the folks who have a ground level view of what's working and where we need to do more. So with that, I don't want to stand in the way of an exciting conversation. So I believe I'm turning it over to Anthony Smith, who's the Executive Director of Cities United, to provide an additional overview of the conversation today. Again, thank you for joining us, and we look forward to being in this work together moving forward.
Thank you, Clarence. Appreciate that. And thank you, Theron and the team for pulling this together. Really looking forward to having this conversation with you all. As Clarence said, my name is Anthony Smith, and I'm Executive Director with Cities United and will be serving as your moderator. To kick us off, I'm going to bring in Fatima Loren to help us walk through Fatimah Loren Dreier, I'm sorry, y'all, who's the Executive Director of the HAVI, to help us walk through and get grounded in what CVI is, the Community Violence Intervention work is, and then we'll jump into the conversation. So Fatima.
Thank you so much, Anthony. Good afternoon. My name is Fatimah Loren Dreier, Executive Director of the Health Alliance for Violence Intervention. I want to first thank our federal organizers for hosting us and my esteemed panelists for our discussion today. The HAVI is a national organization founded 12 years ago, dedicated to transforming structural and interpersonal violence through the expansion of hospital-based intervention programs. As a member organization, we host communities of practice with HVIPs across the country. We help stand up new HVIPs, participate in advocacy efforts at the federal and state level, and help shift narratives away from racist notions about who is deserving of care by humanizing communities of color who are disproportionately impacted by violence. The HAVI is also honored to join several other TTA providers, training and technical assistance providers, as part of the White House 16 jurisdiction initiative that Clarence mentioned earlier. I'm also just so pleased to be joined by other esteemed HVIP members, Ann Marks of D.L.I.V.E and Ray Winans of D.L.I.V.E. I've been asked to provide an overview of community violence intervention efforts just to ground our discussion, so I'm going to get started. So first, and this should not be a surprise to you all, that we ground our discussion of violence as a public health issue, right? So we know that gun violence is the leading cause of death for Black boys and men of color, Black boys and men, and of course, second leading cause of death for Latino boys and men. And so what is the public health model? It's important to recognize that it is both a set of strategies or defining the problem, identifying risk and protective factors to help us think about opportunities for intervention at different levels. So there's primary prevention, where we aim to prevent injury before it occurs, secondary prevention, which reduces the impact of disease and injury that has already occurred, and tertiary prevention, right, helping to mitigate the impact of ongoing injury that has a lasting effect. And so it's going to be important for us to recognize that all of the strategies that we deploy to address the issue of violence is important. But as you'll see in a moment, CVI efforts will focus in. We are a lot more targeted and may not cover all of what we mentioned here, but are certainly complementary to a whole host of strategies that are deployed to address the issue of violence. So I'll talk more about that in a moment. So I want to just ground us, because we are going to talk much more about individual and interpersonal violence, to acknowledge a broader socio-ecological model that we recognize there are interacting layers of trauma that impact what we see at an individual level. And so, of course, there's history and culture. There's a pervasive culture and history of slavery and violence that rages in our country that it's important to acknowledge. There are systems and institutions of discrimination that have disproportionately impacted communities of color, and I mentioned a few here. Mass incarceration comes to mind as a huge impact. Employment discrimination, institutional racism and redlining and housing discrimination have enormous impacts on the realities of communities across the country. But I am going to talk much more about community in place and at the individual and interpersonal level. But I think this context is incredibly important to just ground us that there are much larger systems and culture and history at play when we talk about violence. But we're going to narrow our discussion from here on out. So what are some of the challenges and the behaviors, some of the things that we understand about the nature of gun violence in communities of color? Well, we look to social network research, right, where we find that roughly 63% of violent crime, and these are studies in Chicago, can be predicted through an understanding the network of a small concentrated group of individuals. So that's important to kind of help ground us that we're talking about a small concentrated group that's responsible for a large share of the being caught in the cycle of violence. From our data on the hospital-based side, we recognize that roughly 30 to 40% of those who present in the hospital with violent injuries have an elevated risk of returning to the hospital wounded or dead within 5 years. And so the hospitals as sites to understand those who are caught in this cycle of violence is incredibly important. There have been a number of analysts who look at gun violence and experts across the country and increasingly the world that find that roughly 0.2 to 2% of individuals in any given city are responsible for the lion's share of violence and violent crime. So it's a highly concentrated group that CVI is really the starting place for understanding CVI work. is really penetrating these incredible cycles of violence and trauma that are concentrated within particular neighborhoods or communities. So I want to offer up a case study of Oakland, and of course, Ann Marks is here from D.L.I.V.E, one of the first hospital-based programs in the country. And we borrow this from the slide from the National Institute of Criminal Justice Reform to take a look at what happened in Oakland as a very powerful examination of CVI in action. So at the time, we have Oakland with a population of over 400,000, a justice-involved population of roughly 20,000, and a belief at the time that those 20,000 had a kind of an equally distributed risk for violence or additional criminal activity, but actually through deeper discussion and analysis found that there were actually a very small percent, 0.1 to 0.2%, about 200 to 300 individuals that were at the very highest risk of violence, and thinking through opportunities and strategies to touch and address the specific issues of this client population became the work of the CVI world. And the results were really remarkable. We saw a 50% reduction of non-fatal shootings and homicides over a 10-year period, which is incredibly powerful. It required sustained coordination and support. There was a funding mechanism that allowed for this coordination and resourcing the strategies therein. And we're going to talk more about these and many other strategies that are encapsulated in CVI. So here we have the CVI ecosystem, community violence intervention ecosystem. And the idea is that, again, we're focusing on those who are at greatest risk, who are at elevated risk within a particular city. And there are a range of strategies that are deployed. I mentioned hospital-based violence intervention. That is the work that we do, but there are others, street outreach or violence interruption work. There are peace fellowships or advanced peace, which are focused again on providing resources and cognitive behavioral therapy to those who are at elevated risk that are identified through perhaps an Office of Neighborhood Safety. The gun violence reduction strategy, or some sort of focused trauma-informed, focused deterrent strategies, and there are many others. The key here is that this ecosystem has coverage, right? We want to maximize coverage for those at elevated risk through a range of supports. And they all have some underlying features that I now want to talk about. So first, again, we talk about those at elevated risk, and some of those risk factors, age, certain age demographics will have an increased likelihood. Of course, it's a correlation. It's not a predictive factor necessarily, but it is a correlation that is important to recognize. Criminal justice involvement, previous violent injury, or again, connection in some way to a peer network. Leveraging the credible messengers. So very fundamental to many of our models is the use of those who have lived experience, violence prevention professionals who leverage those experiences and that credibility to have very impactful high level of relationship building with clients who are in great need of support, and provide the real backbone to the CVI work. They are the backbone of this work. They're the leading heart of this work. And that professional workforce has been, I think, not nearly honored and respected for the incredible work they do. And so some of our work, for example, at the HAVI is finding funding mechanisms directly for violence prevention work. We were instrumental in securing a Medicaid designation, a code for reimbursement, and we're working on state campaigns to reimburse for this particular professional workforce. Individual wraparound care, so thinking about not just mediation, although some of our strategies, some of the strategies within the CVI ecosystem focus on mediation and interruption in the short term. We also contemplate within the ecosystem intensive case management, life coaching, thinking about housing and relocation, employment, thinking about stipends as all intervention opportunities to wrap care around clients. We think about the transformation of their lives as an incredibly important piece of the CVI ecosystem. And then we continue to monitor progress, right? The evaluation work that's necessary to see the benefits and the power of this in the long term. We care very deeply about community participatory evaluation, building relationships with clients such that they come back when they're needed, that having a doors always open policy, and also thinking about the transformation of systems themselves. So in order to be successful at providing wraparound care, having those services available, we need adequate housing stock that in which the barriers to access have transformed so that our clients benefit from those services. These are the things that our programs think about, advocate for at a local level, and are critically important to the success of these models in any given jurisdiction. So what I've provided, I think, is some foundation. There are a lot of puzzle pieces to CVI work. And what I hope that our discussion will help us move towards is putting these pieces together, understanding what it takes, what the work actually looks like on the ground, but also understanding how to arrange the puzzle pieces in ways that actually generate an impact. So with that, I'm going to turn things back over to our moderator, Anthony. Thank you so much for having me. We look forward to the discussion.
Thank you so much for that, Fatima, for grounding us and giving us that great overview and really helping us get settled and land the groundwork. So I'm going to pull in Ray Winans and from D.L.I.V.E and Ann Marks, also from Oakland, who's the executive director with D.L.I.V.E. And D.L.I.V.E is celebrating, I believe, Ann, 30 years of work in this field. And as you heard Fatima say,
That's right.
was the first organization that helped do the hospital-based intervention strategy. So a lot of this is built up out of the ground in cities and in communities and then become national best practices. So I want to start with Ray and bring you in. Fatima talked about the credible messengers and the work and the important work that they do. Can you talk a little bit about some strategies that you have used to recruit and retain folks in the workforce in that field, and then also think about how they elevate their work as they do that?
Oh, most definitely. And thank y'all for hosting this. So a credible messenger is an individual that has the respect of the folks in the neighborhood, as well as law enforcement and judicial systems. A credible messenger, again, is someone traditionally with lived experience. And one of the things that we've been able to do with our credible messengers, and it's been unique, is before we hire someone who is a credible messenger, I make sure that it's a non-negotiable that we interview those individuals in their neighborhood on their block. And the reason why we take that approach is because in this violence prevention work, it's dangerous, right? And sometimes people want to solve for their curiosity and not for the issue. And they don't have the respect of their people. I mean, just be quite honest, some guys have cooperated with law enforcement and turned informant and told on the guys in their neighborhood and can't go back. And so they're looking for a lifeline to gain employment. Some other folks didn't follow the rules of the game that they previously was involved in. And so for us here in Detroit, one, we never want to put the person in harm's way and have them riding around again with somebody who may have an open hit on, right? A credible messenger has to be able, again, to walk that fine line, right, of neighborhood and police and bringing everybody together and serving as a bridge, right? You have credible messengers that are elected officials, if you will, right? That people can walk both aisles. The credible messengers, like Fatima discussed, is the engine of the work, right? Somebody who can take a message and just say, like, and I use an example with our partners over at DYVPI. You have ceasefire. You have a credible messenger that can come to a guy and say, hey, man, you know what? You're on the police radar, right? Whereas the police may not want to touch that individual and get that message to him. But if a guy like myself or a Q say, hey, man, you know what? The police tap us on the shoulder and say, man, you've been involved in a lot of things, man. You need to be able to stop that, man, and here's some resources to be able to go another way. Well, guess what? That guy can receive that from a credible messenger, not feeling like that credible messenger is law enforcement. Credible messengers aren't informants, right? The way we train, so once we vet our credible messengers, coaching them and teaching them is the easy part, but being able to validate them through their neighborhoods. And so one of the philosophies that we have is, if you live the lifestyle, because again, like I say, people will try to talk themselves into some work. If you live the lifestyle that you say you did, take us back to where it all manifested at, right? Like Anthony, you done been to Detroit, right? And you see we right in the neighborhoods, right? If you can't go back to your neighborhood, we can't hire you. Because when we're dealing with hospital-based violence intervention programs, we have to keep in mind, and at the forefront, it was an attempt made on somebody's life, right? And it was unsuccessful in order for them to be a part of this program, right? And so being intentional that somebody's already trying to kill the person that we're servicing, right? So we don't want them to get caught up in something that don't have anything to do with them, because this quote unquote credible messenger was in the same predicament and did the complete opposite, right? But the credible messengers are most definitely mighty men and women coming out the neighborhood. And so it was a scripture in Psalms that said, mighty are children as with a man with an arrow. So you can point them in any direction, right? To say, hey, you know what? We need you to go over here and take care of this, or we need them to go over here. In Detroit, when we brokered the first peace deal on the east side, right? We used the mayor, our mayor of the city of Detroit, as a credible messenger to bring the two groups together, right? So I served as a bridge, but in order to get the rivals in sync, had to bring the power players in, right? And so like in terms of like our CVI work, right? Like right now, being able to identify credible messengers, a credible messenger has to have the support of their elected officials as well. Like I see our deputy mayor, Conrad Mallett, is on the call, right? And so he's a credible messenger, but he also validates my credibility in the community, right? And so a credible messenger has to be able to do just that. If you can't walk that line and find appropriate credible messengers, then your program is going to be an epic failure. And pay your credible messengers as well.
No, I appreciate that, Ray, and I was right on point. And I did enjoy when I came to Detroit and the tour that you took me on, and all the folks that we got to meet and see the work in action. Can you do, before I go to Ann, can you give folks a little bit more background on D.L.I.V.E and how you got there?
So yes, so D.L.I.V.E is our state's first hospital-based violence intervention program. We are a member of the HAVI, proud members of the HAVI actually, right? And so it was three co-founders, myself, Dr. Shanui, and Calvin Evans. And so we launched April the 8th, 2016. And we actually came into the first hospital, which is Sinai Grace Hospital. Sinai Grace is on the west side of Detroit and received more violent penetrating trauma than any other hospital in the state of Michigan. And so prior to my work at D.L.I.V.E, I was doing work with the Detroit Youth Violence Prevention Initiative, Operation Ceasefire. And so hearing a lot about trauma across the country, but not being able to, I'm a visual, so not being able to see how it works, if you will, with services. When the opportunity came about to launch a trauma-based initiative, we jumped on it, man, and just got innovative and had the flexibility to do what it is that we needed to be done. And funny that I just acknowledged our deputy mayor. He's over the health department now, but he was actually the CEO of the hospital at the time. And so, and Fatima know when we came to the hospital, we was able to get the hospital support. And that was key to the success that D.L.I.V.E has now. You know, Conrad backed us up financially, emotionally. I mean, in every which way that we needed the support, we was able to receive it. And so it's been allowed us to expand and be the premier hospital-based program in the state.
Nice. Thank you for that, bro. I appreciate that. And it's also good to see you, man. It's been a long time.
Likewise.
I appreciate that. And I want to go back to this ecosystem and that Fatima brought up and talked about the different pieces in the ecosystem. When you think about the ecosystem and you look at the one in Oakland, is the CVI models and is that the only strategies that need to be a part of that and for the community to implement gun violence reduction strategies? What all needs to be a part of that ecosystem, and how do you see it playing out?
Sure. Thanks so much for having us here. I didn't get a chance to say that, but I really appreciate the invitation and could not be more thrilled about getting to see you, Anthony, getting to be here with Ray and Fatima, who's a wonderful leader of the HAVI. And what a blessing to have Mr. Wardell point out the importance of not just having CVI, but scaling CVI. And that's really kind of why we're here, right? It's like it's one thing to try some neat stuff, as another thing to actually reach the population. I think one of the things that was powerful that that Fatima pointed out in her presentation was the scale of the population isn't undoable, isn't unknowable, it's finite. It's not small, but it's not impossible to reach with the right amount of resources. And so I think that's where we're going to. In terms of a CVI ecosystem, you know, Oakland, we are blessed with talent and innovation. We have many of the CVI models, you know, right here at home or in our backyard, you know, including hospital-based violence intervention, which Sherman Spears pioneered here in Oakland. But we also have some of these other strategies, including focused deterrence, including street outreach and violence interruption, and so we're blessed with that. All of these programs rely on our partners who are able to work with us, not just to intervene with people who need our support, generally young men, but people who are able to help them not just see a better way, but get to a better way. So one of the things that we deal with a lot here in the Bay Area is around housing. And so that's a critical part of our ecosystem, not just being able to say, oh, you're in danger, you need to move, but we actually can find the resources or find a way to house you. Similarly, economic opportunities are critical, right? So if you're going to have a CVI program, but you can't provide an employment path out, a way out, then people are going to go back to doing whatever they needed to do to survive. So, so there are critical supports around these programs that can't be shortchanged if we're going to be able to provide a new way of life or a healing direction for people that are caught up in violence.
Thank you for that, Ed. And as you think about that whole ecosystem, you talked about the different pieces needed to be there to support. Who else needs to be at the table? Who else needs to be a part of this when you're having this conversation? So as folks are thinking about building this out, who else needs to be at the table?
Yeah. So who needs to be at the table is all your critical organizational and institutional partners, right? So if we're talking about the city, the health department, the school district, probation, you know, law enforcement, etc. Your organizational partners, your community organizations, your local schools, and most critically, you need your community partners. And so, you know, if you're a community that's looking to start a program, it's not about, well, which institutional partners need to be at the table. It's about who is willing and who is able. So every program really needs to start with your, you know, I think Ray talked about credible messengers. I would call them indigenous healers, right? These are people that are already in the community, that are already doing what they can to make it better, to help. You know, they're already in our community. They've already been called to this work. They just haven't turned their calling into a career yet, right? And that's who it starts with. So I mentioned Sherman Spears. He was called to this work. He didn't know that his experience as a young man who'd been shot was going to make him go back to that hospital and start hospital-based violence intervention, but he knew that he was called to do something. And there are people like that all over. So it's the people, and then it's these partners, these institutional partners. And I would say, even within those partners, it's still the people. So which partner should come to the table? There's a lot of candidates, but the ones that should come to the table have to be the ones where there are people within those systems that are champions of this approach, of this health approach, to the work. And so when I think about our counterparts in Milwaukee, right, they started a hospital-based violence intervention program because of a nurse who said, I watched a young boy who never grew up to become a young man come into our hospital multiple times with a series of escalating injuries. And I knew we didn't do our part, right? Because all we did is patch him up and send him back out. That's someone who had a realization that her institution, right, needed to change. So it's not just which institution, it's who's there and are they going to champion this work? So that's where communities need to start with, not just, well, what would be the ideal partners, but who are the ideal people? Who are the committed people who are already doing this work as a calling, and we're going to help them make it a career.
Thank you for that. And I really appreciate elevating those two stories of Sherman and the nurse, because I think people try to figure out who could be a part of this work and sometimes can't find their way in. But you just really outlined that anybody and everybody should play a role and could if they're feeling the calling. I want to go back to you, Fatima. As you were setting it up, you talked about the data and you talked about the small percentage of the folks who are driving most of the issues that we're talking about, the community violence. What data sources are we looking at, and how do cities get their hands on there to help identify them, but then also identify what services and programs we should be thinking about?
Thanks, Anthony. So, data is challenging. I think that's an understatement. And so I think there are actually a number of sources that can be helpful in painting a picture about who's experiencing trauma. I'm actually going to start with what we know on the street, right? When we talk about what communities know and understand, often that information is devalued, but is actually quite critical to understanding dynamics around violence as they transform in neighborhoods. So I wanted to kind of actually ground us in some of the qualitative understanding of the nature of violence and what credible messengers tap into when they're understanding what's happening in neighborhoods over time. There is, of course, law enforcement data. It exists. It's not perfect, but it paints a picture, and at the very least gives us a sense of who in the criminal justice system is touching people. And that is a risk factor, right, as we mentioned earlier. So just understanding that folks who are touching the justice system are at elevated risk, but that there's also, to Ray's point, that the very powerful and unique position that violence prevention professionals play in this gray area between the criminal justice system as a buffer to the criminal justice system. Having information about how the police view our clients is really important. Helping our clients navigate those systems is really important, but the data itself about where violent activity is happening is certainly a data source. And of course, the hospital data and understanding who are victims of intentional interpersonal harm is really important. There are some challenges with that, and why it's so important to have partnerships, hospital-based or hospital-linked programs, is how the data actually gets captured is complicated. When you have robust programs, either violence prevention professionals are staffed at the hospital, that's hospital-based, or like in D.L.I.V.E and D.L.I.V.E's configurations, hospital linked. So there's separate CBO, community-based organizations that have a touch in the hospital and are able to capture data as it's happening. That's really powerful, because so much of it is who's presenting at the ED and why, and that can, whoever is on staff may or may not have a full understanding of the issue, but as they get trained, as they get connected to these programs, understanding at a much more sophisticated level who's presenting and connecting them immediately to programs is really important. There are, I think, also really important pieces around who is experiencing violence and trauma in communities. We often, it's important to say that we focus on young people and the youth, and of course we care about youth. Youth are really important, but let's not forget our emerging adults and our adult population. because often we'll have programs that have very strict cutoffs in terms of, right, where, and the idea is that this is data driven, right? We've got to kind of make sure that young people are taken care of, and we absolutely do. And we love our youth development partners, all of whom are here. But sometimes data can actually help us see that there are other demographics, right, in that emerging adult, somewhere between 18 to 35, that are experiencing, and no one's touching that population, right? So data as a way to help us understand the reality on the ground. But again, we have to marry both the quantitative and the qualitative if we're going to get the full picture. And that requires, to Ann's point, people and partnership.
No, thank you for that, Fatima, and thank you for hitting that nail on the head about focusing in on using the data to focus in on those who are most at risk. Because I think, again, to your point, sometimes we just start the work and we start to work with those who we think are most impacted at times, and we never really comb through the data, right? So at Cities United, we always ask cities to at least get 5 to 10 years worth of data of who's been shot, who's been murdered, so that we can understand who it is and where they're coming from, so you can get a clear picture. So I really do appreciate you honing in on that. I want to ask Ray a question around data. You've been at this for a while, since 2016 and before. Are there any non-traditional data sources that you use when you do your work, you and your credible messages, when you guys are in the street, that has helped influence how the other folks, the traditional data moves and looks? So have you seen any non-traditional data sets that you guys have been looking at?
So it's interesting because we just, and Fatima, we received some funding from the city. We was awarded a grant to start our community outreach piece, and it kind of go with Fatima was saying, right? And so what we recognized prior to receiving this funding to start our hybrid model was in the hospital, our cutoff period was 30, right? Just like traditional people, right? 14 to 30. But the more and more we started seeing like some of these older guys coming through the hospital, and I'm like, this guy only, like, he just missed the line at 31, 32. So start having these conversations. Guys say, man, I just did 14 years in prison. I went in when I was 17, right? And he just coming home. And it's like, okay, so we got unresolved issues. So we had the flexibility and the support of our elected officials to go into the neighborhood without that cap, right? And so like one of the young men on the call now, he came home and was like, man, look, we all coming home now, right? And so that was the data that we was able to collect. Like, how many guys y'all got coming home, man? It's like, man, there's about 20 of us. Hold on, wait, and all y'all been gone 12 to 14 years? Yes, hold on, we got to capture all these guys, right? And so what we were able to do was create that opportunity in that pipeline to service all these guys that had this value add, right? Like, okay, you know what? Your homeboy's telling us you coming home, we own you before you get here, right? And so we're in the process of developing this, but we knew that we had to use a strategy in order to be able to grab hold to these individuals to prevent and or not instigate, because if a guy come home after doing 13 years and all the guys and some of these guys who were 17, 18 years old, they didn't know him, right? He coming out, he's like, hold on, how everybody getting help? But we the ones that started this, right? So now you got internal conflict, right? They like, hold on, y'all haven't earned anything to get these resources, man, right? So now they got to press the little guys. And the little guys like, hold on, man, y'all been gone too long. We done had to carry this thing. So we're in the process of developing, and I'm pretty sure within this next year, especially since we've strengthened our partnerships, we will most definitely have some good qualitative data in regards to that. But that population of 40, and I'm saying 40 intentionally, from 25 to 40, right, is very crucial to this work and have a different value add. And real quick, we've strategically aligned these guys up to apologize to the younger guys and get them to take ownership of the value of the community in which they left it, right? And so one of the things that some of the older guys are saying, well, we need to go back to the old days. I miss the old days. And to be quite honest and be real bold, we was like, damn the old days. The old days is why it's here right now, right? So like, let's apologize to the youngins for leaving them something that we messed up, right? They took the game that we gave them, carried it with no guidance. So first and foremost, come back and apologize, and then let's make it right. You know, so that's where we at with it here in the city of Detroit.
No, love that. And I really do appreciate that alternative data set that's influencing the work, and that you're seeing that. And now there's been folks are also giving you resources to address that too, right? Because I think again, credible messages come in multiple places, and you're a credible messenger in many ways, even to funders and to the city to say, actually, we still need the dollars for what we do, but there's other population that we need to pay attention to. And then also that piece, and I think Ed touched on it too, that healing piece. There's a lot of healing that needs to take place, right? Not just from the folks in the community, but also from the systems that have created this environment. So there's a lot of work for us to do on that end. And cities are thinking about getting started with this work and looking at all these different approaches that we're going to continue to talk about. What are some of the important questions or key questions community members should be asking themselves before they just pick an approach, right? What is it the cities and Fatima too, once, and I'm gonna come to you on that too, but what should they be asking themselves as they think about all these different approaches that before they just identify one and select?
Yeah, I appreciate that. I'm gonna answer your question, Anthony, but I just want to go back to Ray because, man, I love you. Like, what an example, right? Someone who's an indigenous healer and was like, "Oh, what's this model? I think I can work with this," right? And started this hospital-based violence intervention program. But you're clearly already doing the work. I want to go back to data because you described something that I think is really important for cities, which is there's all kinds of data sources: law enforcement, criminal justice data sources, health sources, right? Either hospital data or injury surveillance data at the public health or state level. All this data is important, but as important is how we make meaning of it, right? So saying there are these dudes coming through that are in their 30s, you could draw all the wrong conclusions, right? From what does that mean, right? You know, Ray and your team, you figured out what the meaning of it was, and I think one of the ways that cities have failed, is that we have employed outside researchers to not just collect data, but to make meaning of it, right? Or we've collected data and we've only included certain partners. Maybe it's law enforcement partners to make meaning of it. And the truth is, like, the data is an essential piece, and how we make meaning of it, who we bring in from the community to provide that insight is essential, right? So I think that's a key, and that actually gets into a little bit, right, your question. So I apologize for the sidetrack, man. By the way, I'm the
No
only person here with a headset too. I'm like, do I look like a telemarketer or do
just a little bit.
okay? I tell
It's
myself
all
I look
good.
like Janet Jackson, but yeah, it's not the same. Yeah, well, you know what? If you just be happy, you don't hear the kids behind me screaming. So on to your question, like, what can cities do, right? And where do we start? And it starts again with who we connected to, right? So all of these models work. They've all been studied. They've all been proved. Not all the world, but the ones that Fatima so eloquently pointed out, right? They've all been proven. So where do we start? We start with where your talent is and where your passion is in your community, right? So you can't start a hospital-based violence intervention program if you don't have a hospital partner that wants to play, right? Or maybe a county health partner, right, that has influence in the hospital that wants to play ball. You can't start there, right? You can't start a focused deterrence program if you have a police department that doesn't believe in the model, right? That thinks, nah, these guys don't need a way out; they need a way into prison, right? You have to start with where your partners are, and who's available there. So I think all of these models actually have um, a lot of key partners, right? And so it has to start with your community. The second thing is it has to start with not just sort of who are the partners willing to come to the table, but who are the leaders in your community. So, um, you know, we were lucky to know a woman named Marilyn Harris, who was an incredible community leader, who on her own had taken her own personal tragedy of losing her son to violence and had said, I'm going to find all these other moms and I'm going to help all these communities and I'm going to stop, the grief, stop the retaliation and start healing the grief after these traumatic situations happen. That was her own personal experience. So you're able to plug her in to build right? The support around that. That's just an Oakland example. Every community has people who have their own personal experiences that drive them to work with a certain community and make them adept at certain kinds of models. And so it really has to start there. Right? Who is already in our community doing this work, and what are their skills and talents calling them to?
No, thank you for that. I appreciate that, and use the space to get what you need. So don't need to apologize if you want to go back to a question. Yeah, that's more than fine. Fatima, you are going to be working with us on the CVI collective and helping cities identify what questions do they need to be asking themselves as they think about which one of these to bring, or if it's a mix. What's the questions?
I think just in endemic in your question is, I think one of the myths we want to bust, which is that you've got to choose one and only one, like there are winners or losers. It is an ecosystem. We're ultimately building the scaffolding of an ecosystem. So people have to understand and recognize when you're building a building, you start with a foundation, and everyone's foundation is different, to Ann's point. You start where the will is, you start where there's opportunity to get going insofar as you are covering this population. I think that's a really, really critical piece where you start, that the coverage, because that's where we're going to learn the most. It breaks my heart sometimes when people come to us and say, we really want to start a program. We have this hospital partner, but the violence is actually going to a different hospital, right? So because that hospital maybe is a level 1 trauma center and has the expertise to actually treat the physical wounds. And so we have to have a conversation. Okay, how do we leverage where following the clients where they are? So that's important, but it's not about choosing one. It's about thinking about it as scaffolding. What's going to be your ground floor, and how do you build from there? And no one ever expects a building to be done in a week, in 2 weeks, right? We have, talk about, infrastructure. We have bridges that take years and years to build. And yet the time horizon for expectation of change when you do pick a program is like 6 months, a year, which we think is just false. This is so much about establishing the will and the partnerships. It's about ensuring that we're learning as we grow, professional development for our frontline violence intervention workers. There's so many components of this work to ensure that it's successful. It takes years. It takes years to build right and sustain. And we are all reeling when we see spikes in violence, right? So I want to speak directly to COVID and that impact. It's had an impact on all communities. We would never question, for our law enforcement, when violence changes, we don't then say, well, then, law enforcement work didn't work, right? And I know that there's a lot of debate about the role of law enforcement. In CVI, it is a complementary strategy. There are a whole host of strategies, and ones that focus on the healing and transformation of people. And that public health perspective is a paradigm change. It truly is a paradigm change, and one that people are fighting for. But it takes tremendous to make that shift. Someone asked in the chat about what are some of the large challenges on the ground. To make that shift in the perspective that those who are caught in the cycle of violence are worthy of care. They're worthy of the opportunity for transformation over and over again. They have a voice, and maybe have not ever been by systems listened to around what their actual needs are. I can't tell you how many times as I walk across the country, and not walk, when we were travel across the country and talk to HVIPs, folks would say some of the most profound work we did in the beginning with our clients was like getting them an ID, right? Like getting access to services, asking them what happened to you, right? And they might talk about trauma that happened when they were a child before they talk about what happened last week. This is the kind of, that level of work, that deep, intensive work takes time. And it requires partners that understand the time it takes and the patience it takes to build something spectacular. People want results that Oakland had. It took Oakland a long, long time. And the results happened over a 10-year period, right? That's important to name. And we always have to tweak. We always have to improve. Ray, I think Ray should teach a master class in understanding reality on the ground and shifting and adopting to make sure that whatever programmatic work him and his staff do are in lockstep with what the needs are on the street, lockstep with the needs are when he goes to the hospital, lockstep. And that kind of work, that kind of problem solving in the moment, that's the attitude, that's the behavior we would need from all of our partners to actually be successful.
Anthony, can I add something to what Fatima just said?
Absolutely. Yes, you can.
Fatima, I thank you for that, right? So when thinking in terms of a CVI, I think like Fatima nailed it when don't think from I have to pick one or the other, right? I use the word teed up. The way we just teed up the city of Detroit was super intentional, right? So we were blessed and fortunate to get the support of the city. We spent down like 1.1 million, right? But it was predominantly in workforce development for our neighborhood-based programs, not hospital-based, right? What that allowed us to do was to be able to say, okay, figure out who has a hot face and who don't. And what I mean by a hot face, everybody can't go to work because they've done stuff that unfortunately some people don't want to forgive them about, right? Whereas others can. But here's what we were able to do. In the hospital, when we have a survivor of violence, traditionally it would be like, hey, you know what did they got to do to get shot? Well, we learned to allow a victim to be a victim, right? And so we were able to serve as the credible messengers between the neighborhoods and law enforcement to change the perspective and understanding this one thing. If this guy shot somebody yesterday and he got shot today because of what he did yesterday, if you guys aren't charging him today, he's a victim today. So we don't care about that yesterday. But the other part of it is we're talking about the health of individuals. So if a guy comes through the hospital, he know who shot him, right? Regardless of what he tell the police, a guy or a young lady, let me be intentional, guy and young lady know who shot them 95% of the time, right? They don't want to cooperate. They don't want no problems. They like, look, I'm glad to be alive. Well, when you have the right staff in position, what happens is they'll tell myself or one of my staff, hey man, I got shot because of X, Y, and Z. It may take 3 months, it may take 6 months, or it may take 3 hours, right? But whatever that situation is, if you have what we've been designing as a hybrid model, now the guys on the ground can go into that neighborhood. Now it's on our radar who the shooter is, right? We're not law enforcement. We're not going to make no arrests. We're going over to the shooter because now you're sick. You have a mental illness, right? Something happened in your life, whereas now we have to give you this medicine, hit your goal planning form, right? This is your prescription, my guy, right? And so being intentional about that, because our experience has been, we've had to get guys in the room, victim and perpetrator, to mediate the conflict, right? To resolve the issue. Nobody went to jail. The issue got resolved and we was able to take the work to the next level and cool things off in a certain area, right? Just by having the victim and the perpetrator. And share this with you real quick. We had a situation where a young man shot another young man and we had to go to the mothers, right? The mothers mediated and negotiated what they wanted. The mother of the victim, her justice looked like this. My son comes over to your house, skips school and everything, and you got him off into the streets. Here's what I need you to do. Anytime he come to your house, send him to school, and I need you to stop popping perks and sipping lean. You do that, I won't press charges on you. Today, that young man been clean for 2.5 years. But that was justice for that mother. She was able to save her baby, and she was ultimately able to save someone else's baby. Right? So don't think, like Fatima said, don't think in terms of one or the other. Think in terms of how do we get innovative and create the both through this opportunity, because it's needed.
Yeah, no, that's real. Thank you for that. And thank you for both for highlighting that, we've got to think about the victim and the shooter, right? Because at any given time, it could switch and be either or. And we've got to understand that the folks who are in this are victims of how systematic racism and other things have been at play in the first place that ended up creating this environment for that to happen. And I think folks got to understand that, right? When we get into this work and we start this work, we don't get to pick and choose, right? The data tells us where to go. who to work with and how to put them in. I want to go back to Fatima real quick, but I got a question for you next, though, Ann. Can you take a little bit deeper dive on the advanced peace, the Peace Fellowship, Fatima, just so folks understand that and what that is? Because I think that also goes into this messaging that Ray just talked about, you know, how folks talk about the work that we do and who we work with. So can you just talk a little bit about the advanced peace model?
I'll do my best, but I will say that recommend our next webinar include Devon Rogan, innovator of that model, and many others who have been innovators of that model. So advanced peace, also called peace fellowships, really takes, again, a very similar core principle, which is you find those who are at the highest risk. And I think advanced peace takes that to the next level by finding those who are at the highest risk and offering them intensive life coaching and the ability to get paid to take care of through a structured using the principles of cognitive behavioral therapy, a structured approach to their own transformation, and be compensated for that work as a fellowship. And that it's managed by an Office of Neighborhood Safety or Office of Violence Prevention is very, very powerful. And this work, although it had antecedents in other places, launched in Richmond, and in a recent evaluation saw an 80% reduction in violent activity, which is incredibly powerful and merits further study. Again, the components are there. If you are able to wrap around care around those who are responsible, if you can find them and empower them, ensure that there are coaches and supports for folks, the transformation, the opportunity for transformation is right there. And Advanced Peace is launching in a number of cities. It requires deep, intensive city investment, and I think that's a really critical part of the way that I certainly heard Devon talk about this work, that it's about the city owning this strategy in a very directed way that's very intentional, because the culture of the city and how city views those who are at highest risk of possibly shooting or being shot is critical to the transformation of communities. The perception is, so just to take on an advanced piece is to shift that perception, because you're putting dollars into the transformation of life, and with a very explicit health approach, again, grounded in the principles of cognitive behavioral therapy, which is one of the most effective ways for behavioral transformation. So just wanted to put that out there.
No, thank you for that. And I did put a link into in the chat so folks can go look for more, but thanks for giving that high level overview, because I think it is an amazing program. And before I move into the implementation of the work, we've talked about the basics and we talked about getting started. One of the questions was in the chat that was around, I asked you, because I think you all do, are there examples of concrete partnerships between school systems or individual schools? And how does that exist in the work? So really thinking about how schools show up in CVI and what role do they play?
Sure. So so we've talked about, right, adults being involved in violence and often being the ones that are injured by violence, but obviously young people also have been mixed up. And actually in Oakland, what we've seen last year or so is an incredible number of juveniles who are getting involved in violence, and so and the juvenile victimization coming up. So so schools are obviously a critical partner for that, and there's a couple ways that communities can work with schools. So one is, right, schools are a place where violence can happen, right? Often because kids who don't see each other on the block will run into each other at school, and then conflicts between their friend groups or their neighborhoods can bubble up there. A second reason that schools can be an area for violence is because schools are often, particularly now middle schools, are sort of recruitment areas, right, for certain types of gangs and groups that are looking to bring young people in. And so that can be another way, right, that we can see violence bubbling up in those places. Critical school partnerships are partnerships where schools call not the police as their first go-to when they see violence bubbling up, but they call credible messengers. They call community partners, people that have, the gravitas that that Ray kind of described in his example, right? To come in and say, how do we, mediate this? How do we work on this? I'm just noticing in the chat someone talking
Yeah.
about Oakland
Yep.
Tech, which happens to be a block from my house, and the shooting there. Um, so yeah, people are always shooting at students. So I think what we're seeing now, let me just digress for a second. One of the things I think we are all worried about is we've lost the protective factor of school, right? Because kids have not been at school. Our young people have not been at school to have that support, right? To keep them, to offer that structure and to offer that mentorship. So that's one reason that we've seen violence go up in a lot of communities. And then a second thing we're now seeing is it's not all going to be, happiness and rainbows and ice cream coming back to school in person, right? Because these are now people that have been messed up, right, psychologically by this pandemic and not having school, and now they're kind of going to start running into each other. So without getting into specifics of that situation, I think what we're seeing is, right, you can't just throw everyone back together in a situation and be like it's all going to be fine. So schools as partners can be referral sources for identifying young people that they know to be at risk. They can be partners to help be mentors for young people that are involved in violence. And so one of the key things that we have done in Oakland is we have gotten rid of, through the George Floyd resolution, we got rid of our school police, and we've said we're going to find other ways to intervene and support young people so that they don't get caught up in violence, they don't get caught up in the juvenile justice system. And so school partnerships are critical for that.
Absolutely.
And you know what? I thank you
Go
for
ahead.
that.
Yep.
Because that's key. And to that, what tends to happen in the school trickles out into the neighborhood, right? And so if you have a group of, just say you have two separate groups, and they get, say it's 10 individuals, 5 and 5, they get into a brawl. Traditionally, those 10 young people are going to jail or juvenile, right? So now you can put 10 kids in juvenile based off their actions, unresolved trauma. They get into the juvenile system. What they're going to do, they're going to recruit some more people for their group, right? They get stripes by being able to say, we just had a big old fight in the school. But the most important part about it is when you take your credible messengers and allow them to intervene, right? You can take 4 credible messengers with those 2 groups, put 2 credible messengers in each group, and have to probably spend 4 or 5 to maybe 8 hours, right, in a restorative process, right? So like our partners, Detroit Youth Violence Prevention Initiative, they're the experts in the restorative process. You can restore the harm that's been done without a kid even having to get kicked out of school and going to jail. Because here's what law enforcement don't do, school police and or the counselors. They can't afford to be out of the classroom for 2 to 6 hours resolving an issue between 10 individuals when they have 1,000 other students to teach and educate. So the credible messengers serve as a secret sauce in those schools as well. Thank you for that, Ann.
Oh, thank you.
Thank you both. And I think that's right. And I think that's what folks got to realize there's other methods, right? And there's other opportunities. And the credible messengers don't have to just be in the community and the neighborhoods. They can be in the school. They can be in the community centers. They can be in different places where young folks are, where conflict might arise, and be there to help mediate and that work. So I think that's important to note. So let's talk a little bit about striking the right balance. I want to start with Fatima. We talked about all the different players and the different roles, from law enforcement to public health to the community, the credible messengers. How do communities strike the right balance between community support, public health, and law enforcement when they implement these strategies?
That's a really important question, and it's one of those things when you know it when you see it. I think it's a really critical component and dimension we haven't mentioned here are our advocate community, and I think it speaks to the power of community leaders who have a passion and a love for this work, and the voice they can lift, and the role they can play in accountability, the role of coordinating councils, coordinating bodies that allow for the data sharing, allow for the discussion about cases with a tremendous amount of trust, with a tremendous amount of respect for all the different contributions each stakeholder has in addressing the challenges and awarding the wins. With funders who understand the complicated ways in which this work emerges and changes, that can be flexible. One of the things that we contemplate as we think about, and again, Clarence mentioned this at the beginning of the call, is what would it mean to bring a new kind of scale of investment in this work without damaging the kinds of relationships that we need in order to be successful in this work. Then we have to center equity. We have to ensure that community-based organizations that are doing incredible work, that house many of the frontline violence intervention professionals, whether they're hospital-linked programs that are housed in CBOs or street outreach programs that, and again, many others, the school-based intervention work, that those programs have access to these resources in ways that are equitable, that the conversations around participatory research are at the center, that research isn't a bad word or a word that, and I love what Anne said, I'm going to reiterate here about meaning making, that people get, there's equity and there's shared responsibility for meaning making, so that we can understand what we're seeing on the ground, because it is something that is unique to every jurisdiction. There are themes, hypotheses, right, about what we think we see, but it is until we are kind of working together and thinking together that I think something emerges, and those adaptive capabilities are possible. So you know it when you see it. A healthy partnership has trust. There's equity in terms of the engagement. Funders have flexibility in their understanding of the work. It's data-driven and data-informed, but not to the point where it misses the qualitative, the shared meaning-making. There's a whole host of ways in which we have our wraparound service partners, housing, employment are at the table and are understanding from the client's perspective where and how their clients are navigating through those systems and are motivated to transform and make accessible what has been inaccessible. We know it when we see it, and it looks something like that, and much more, right? And much more. So I'll stop there.
No, thank you. And you guys have been at this for a while in Oakland. You all are a city that a lot of folks look to. How did you all get to the right balance, or how are you all getting there if you're not there, right? How does it look in Oakland, and how are you all consistently shifting that balance to make sure you got that is moving in the right direction?
I appreciate you saying that that we're doing a good job here in Oakland, and the truth is we got a long ways to go. So yes, Youth Alive has been around 30 years. I hope it doesn't take another 30 years, right, to end violence here in our East Bay community. And how we've gotten this far took a number of things, but what I want to highlight is a local initiative. So in 2004, Oakland voters, we voted to tax ourselves to support three things related to public safety: police, the fire department, and for the very first time, violence prevention, a violence prevention fund, which had never existed. So, the city had one-off programs and in different violence prevention related concepts. I actually at the time was working for the city in a prison reentry program, but this was the first time we said we're going to sustain funding for a variety of targeted initiatives to do this work. Now that fund over time was reauthorized. It has since grown, and most recently our city council decided to add to that specific fund with general fund money as well. But what the result has been is a sustained investment in some of this work. and the truth is, when we started funding it, we didn't have all the models in place. We didn't even have all the organizations in place, right? So it took time to build the organizations, to implement the models, to educate ourselves, to train ourselves, to identify all the indigenous healers in our community and provide them pathways to get trained and become professionals in this work. So it took a long time, but it never would have happened, not just without resources, but without a sustained commitment to making those resources available. Because nobody's going to start an organization with 1 year's funding.
Even though they're asked to all the time.
Even though they're asked to all the time. And just put on my city hat for a minute. When I worked for the city, something that I felt really strongly about was all of these government contracts were going to start with an advance. Because it's ridiculous to say start this work and don't get paid for it. How are you going to hire up, right? Like how are you really going to have a community organization start this work without money?
Say bill us in a month and we'll get the check to you in 2 months. Yeah. So no, I hear it. Couple of things I want to make sure that we hit on that, right? Because we've been talking about credible messages. We've been talking about this work. And we know across the country, a lot of folks do this on a shoestring budget. We are very excited that the administration put dollars out and asked folks to use their American Rescue dollars to support this work, because it's important, because we've been paying folks peanuts to put their lives on the line and not giving them the support that they need. So we want to make sure we just elevate that, the cities who are listening and folks who are thinking about these programs, making sure that you are putting in the right support for these folks who are doing amazing life-saving work, making sure not only that they get paid well, but that they have the right support. And I know Ray and his team in D.L.I.V.E also help provide mental health support to their team, because this is, they're re-traumatized and they're putting themselves in harm's way. So we just want to make sure that as you're doing this, please do not do it on a shoestring budget. Give it the resources that it needs, and make sure that you give it resources for years to do the work, because you've heard all of our panelists talk about it takes time. I'm not closing out. I just wanted to hit that point. Ray, I do want to come to you as we're thinking about this work and we're building it out. COVID did hit. Fatima brought it up, and it impacted us a whole in all different kinds of ways in doing this work. But there were folks still had to go do this work. How did COVID impact you and your team, and how did you all maneuver in this work, and how did you all still do this life-saving work during COVID and still in COVID that we're in? Yes.
You want me to tell the truth, or you want me to sugarcoat it, Anthony?
You know, we're all about the truth, bro.
Listen, no. So let me tell you, right? So when COVID hit, I'll be the first to admit, right? I'm like, hey, I'm a 5-star general, right? But it scared me. I watched the news until I got sick and everything, right? The team was like, Ray, we got to do something. And I'm like, man, stay in the house, y'all, stay in the house. And one of the young guys said, man, so one of my staff said, Ray, you can stay in the house, but we can't. And I say, all right, man. So I'm sitting back and I'm just accepting the calls from the team. They calling me, telling me what's going on. And then some just say, Ray, you know what? You got to get up. Get up, right? Like, you know how your team is. If your team can weather this storm, you weather it. And so what we end up doing is just coming to the realization, and it's very unfortunate, but this is the reality, that the young people and the work that we do, you are more likely to catch a bullet than you are COVID. And it's unfortunate that most of the people we serve, they're not thinking about COVID. They're thinking about how to survive and stay alive, right? From people who are out to kill them and things like that. And so it pivoted us from the hospital. And so we was able to do, and again, it comes down to the relationships as well, right? The relationships are powerful. So we was able to partner with the trauma surgeons, right? Because our hospital, at the time, man, they had news stories and all types of stuff, man. It was just hell. So we went to tell, and Fatima knows this. We had to get iPads and things like that, and trust and rely on the trauma surgeons to call us and our social work team to say, hey, you know what, you got the shooting victim, you know. So it wasn't weird to have a trauma surgeon FaceTime me and me talk to a young man or a young woman while they're at the bedside, and I'm like, hey, listen, give me your number, give me your mother number. We're gonna provide groceries for them right now. During this time, Fatima, I think we was really being intentional. We started having lunch with folks over Zoom calls. Our trauma peer support groups, right, went to Zooms. But then it forced us to go into our neighborhood-based response as well, because violence, it was just a huge uptick in the neighborhoods. And so that's when we actually opened up our neighborhood resource center during COVID. during the pandemic, right? So that response, it forced us to elevate our work, take it to the next level, and fear not and be courageous. You know, we're dealing with a Joshua generation, right? And so it worked out. You know, it worked out. I'm thankful and grateful for it. But it was the team that just jumped in front of the bull and said, "Hey, you know what? We gonna show you that we with you, Ray. We're gonna grab this thing, and then you come and help us wrestle it if you see that we got it." And so that was our response to it. And again, like I said, it worked out. We had the support of the hospital, the trauma centers, trauma surgeons, the folks who wanted to help. And then again, like I said, shout out to our mayor, man. He most definitely seen the need and was just like, I don't care what it takes to get it done, get the shit done, And so we was able to move and establish some things that didn't exist prior to the pandemic for our organization.
Nah, that's helpful. Thank you for being real and transparent, because I think that good leaders follow their teams as well. So I think that's very important for folks to hear as well. And I think what I don't think people realize during COVID is that frontline workers, credible messengers, folks doing this work was also taking the message about COVID. Wear your mask, wash your hands, get the test, right? So these were trusted folks again who were able to move a community that was not trusting of all the information that they were hearing, but we're hearing it different when folks from your team and others across the country were actually in community. And to your point, they understood that they could not stay in, because if they stayed in, we were going to lose more people to COVID and to gun violence. So they're like, how do we put ourselves on the line? Again, it's a plug and a place for us to be real clear about how we support these folks because of the work that they do. And indigenous healers, as Ann says, there's important work that needs to be supported. Go ahead, Ray.
Anthony, I'm glad you mentioned that. So, Director Cheryl Jones, I believe, is still on this call. She is the director of the Detroit Youth Violence Prevention Initiative, which ceasefire is one of the components. But one of the things that I was thankful and grateful for her team was they was able to provide. I'm talking about thousands of masks, hand sanitizer. And so it allowed us through that partnership to receive something. And so even if it just came from us just doing the food distributions and passing out the masks and giving up the information and being able to move forward. And so again, being able to have the right partners in that response as well was key to a big part of our success as well.
Yeah, thank you. Appreciate that. Good conversation, y'all. We are we got about 13 minutes left, so I got about 3 questions, y'all. I want a response from all of y'all. Y'all got about 90 seconds, so however y'all manage that, so we don't get cut off the screen. As we think about this work, and that you all have all been in it for a while, looking back over your experience as implementing these strategies, some local in your community, and Fatima, you're across the country, then also some of your community. What would you do different at the start? Where would you spend your time at up front? And then what partners would you include at the outset? I'll start with Ray, and then I'll go to Fatima, and then Anna wrap us up.
I wouldn't have done anything differently because again, it was through our pain and our gain was our education. You got to pay to get a good education. You got to pay tuition. So for me, I'd be honest, I wouldn't have done anything different from the start because I think we followed the protocol. We reached out to Youth Alive, went through Kendra, right, off rip, and just being able to have that experience. So yeah, I wouldn't have done nothing different. Honestly, nothing.
Anybody you would have brought to the table sooner, or everything?
No, we was intentional. No. If you invite a pit bull and a chihuahua to a meal and both of them hungry, somebody ain't gonna eat.
I got you. What about you, Fatima?
This is very funny. I have, of course, a different perspective as a national organization. So I'm going to talk more about the ecosystem that I think one of the challenges as a national organization that focuses on one model and one that was kind of incubated at Youth Alive that had the kind of on the ground experience is that we really built our network to be a community practice and really facilitated the kinds of peer learning. So just as Ray said, when folks were ready to launch, they had teaching programs to go to see it, to have discussions with staff who've been in it, who, and I think that as we talk about model fidelity and the growth of this across the ecosystem, it's going to be so important to build out those communities of practice. At our conference, we don't distinguish between violence interrupters and violence intervention specialists who do hospital-based work because they're one and the same, right? They're out there they're at different levels of intervention, but the credibility, the work, the honoring, the respect, that community building is so vital. I am so pleased to see now that there are networks that are growing for the offices of violence prevention in cities to also build those communities of practice, led by David Mohammed, who also leads National Institute of Criminal Justice Reform, and Devone Bogan. I'm pleased to see these new kind of emerging organizations, the community-based public safety collective that Akila Sherrells has launched, that's also trying to build the community of practice around community-based public safety, that we all, I think, need to leverage these best practices of how to share information so that we don't see these kind of beefs between interventions on the ground, or these kind of like, okay, what's your lane, what's our lane. It's our collective work, it's our portfolio of work. We've got different pieces of it, we have different access points where we understand it, but I think that sense that we're actually all in the same family, right? And that we see it that way is a really, really important piece. And I wish we had started that way, right? I wish that, we go back 10, 20 years when these models were growing and people were beginning to find each other across the country, that funding allowed us to grow in this way. And unfortunately, it wasn't the case. But I am so proud to see those, I think people beginning to see the opportunity collectively and say, we're going to go for this together. And we've got to continue to do that as we scale, and not have hard feelings when an intervention, again, in that scaffolding model where it's about, what do we build upon? When a city selects a place to start, that we understand it's to build that building, right? It's not to stop there. And so I think just, the presentation I gave today is something that I would have just talked about HVIPs, right, a few years ago, and talked about the model itself. So it's exciting that we're moving towards having shared language around what the things that we have in common, and why the ecosystem is where we need to invest.
No, I think that's smart, and I appreciate that. And I think that's, the beauty of the White House's CVI collaborative is just that, right? You get Cities United from us, HAVI, Nick Jr. and the collaborative coming together to go work in these cities, but also with our other partners. I think it is an amazing way for us to merge, to your point, and really go into cities and help them see the whole of the work and not just pieces of it, which I think people have been doing for a long time. So, and anything different, any people you would have brought to the table as you look back over the work?
Well, I will say to Fatima's point, 28, almost 30 years ago, when we started doing Caught in the Crossfire, our hospital-based work, there wasn't street outreach, there wasn't violence interruption in our city, there wasn't homicide response in our city. So, the people that were doing this were doing everything, right? They were doing all of it, right? And for a lot of the people who are here, you might be in cities that are smaller than Oakland or Detroit. It may be that in your city, it's always going to be the same 5 to 10 people that are doing all of these models, right? Because they're workers in this field. They're violence intervention, violence prevention workers, whatever you want to call them, right? They're the people doing this work. And so they might do all of it. They might be in the neighborhood. They might be at the hospital. They might be in the school. So I couldn't emphasize more, right? That it's about learning as much as you can from others, and being true to what your community needs. And so to answer your actual question, what would I do differently if I could go back in time? I'm sorry, you knew when you got us here that we were just gonna talk about what we were gonna talk about. But I appreciate you, Anthony. I think the thing that if I could go back, the only thing I would say that I would do not differently, but more of is investor relationships.
Mm,
The truth, all these models only work because of relationship. Healing
yes.
only happens in relationship, right?
Yep.
You know, and I think it's important to recognize the importance of clinical, right, therapy, as well as, you know, non-clinical community healing. But I'd say that to say all of our relationships, that's where you cannot put too much money into it, not just our relationships with, you know, people in the community, but our relationships between our organizations, our relationships between our institutions. Everything you put into those relationships is going to bear fruit. And so that's the thing. If you're going to start somewhere, start with building those relationships.
I
That's
think
real.
that's really, really important. All right. You jumping in, Ray?
No, I said that's real support.
Yeah, that
Again,
is real.
relationships is the secret sauce to all this.
That's how you get it done. It don't happen without them. And I think you all have really, really highlighted that throughout the conversation. Those matter. And I think, you know, one of the points that Fatima made is that we all have lanes in, and we all need to work in partnership in those lanes so that we can get this work done. Because at the end of the day, it's about saving lives, right?
Exactly.
And it's about making sure that we can create an infrastructure and a system where hopefully all of us can go do something else at the end of the day, right? Because we're trying to stop this stuff from happening, and we want to create an environment where we don't have young people who continue to go into this pipeline of community violence that we know has been around for decades. This is not a new conversation. So,
Just if I could interject,
yes.
Anthony, and just give my praise to Cities United as a group that that has really helped shift conversations at the city level and encourage cities to have a plan and an intentionality around this work, because it allows, I think, the independent organizations, whether they're national or local, who are doing this work to kind of sync up with people who understand those values, those conversations. It's going to take all of us, but the stakeholder at the city level is pretty critical to the success. You know, I think that Cities United, in building those peer relationships across cities, gives us this opportunity to I think, keep track of how cities are doing over time and encourage, even, you know, because one of the, I think, hardest things for our movement is when leadership changes, right? When leadership changes at the city level, suddenly things that felt pretty solid and comfortable and okay, I think we're on the tracks, can totally transform. It's like, who do we call for that, right? And so I think just the role that cities play is really, really critical. And the role Cities United play organizing cities around this is incredibly important. So thank you for your work and your leadership in this. You know, we need it, and we need more of it.
Thank you for that, Fatima. And thank you, because we would not be where we are without any of the work that you all do. We just get to come in and highlight your great work and make sure that folks know they have their strategies and their resources. We are at the end, y'all. This was an amazing conversation. We could go on for hours. I really appreciate being in space with you all. I really appreciate working in partnership with you all. I'm going to turn it back over to Dan to wrap us up and close us out. So again, thank you all.
Good job, Anthony. Good job, man.
Thank you, bro. Good to see you, man.
Likewise.
Anthony, Fatima, and Ray, we can't thank you enough. I know through messages that are coming through the chat, through our emails, phones already, people are asking, how can we get more time with you? How can we connect with you? We know that you're not the only ones doing this. We'll try not to send everybody your way, but you've certainly made it clear that gun violence is preventable. But it does take a community. It does take a passion and a commitment. And just really enjoy what you all offered up. Reminding us again, it takes some humor. It takes focus. And, you know, we know that you all are incredibly busy. And so even pulling this together, we know that you're already pulled in 1,000 directions, which is why we asked you to almost do this marathon conversation, because we didn't know how many more times we might get with you. But you took us through the basics of what people need to be reminded about at CVI. You helped us to really think about getting started, and that it's not a choice between models, but it really is a choice about people and partnerships and how to get started there. You talked about striking the right balance and what it takes. You really emphasized again for us what credible messengers are and mean, and how we go about securing them and taking care of them. And certainly to sustain this work, a plan is necessary, an intentionality is needed, and you've shown that this can have a life. Progress is not linear, so you have to continue with that eye towards tomorrow. And so I think what you all lifted up are a lot of strategies around sustainability. So I have the unfortunate duty then to close out this webinar. And I know already people are saying they want more. So I want to remind viewers that this is being recorded. You can go back, you can listen to this, share it with your friends, your colleagues, let them know of this great information and these individuals here. And I can tell you, if we can create more Anthony's, Fatimas, and Anns and Rays in the world, we will in fact solve this problem of gun violence. We also are going to take a moment, and we'll leave it open for a little bit, in terms of dropping in the chat a survey, reminding you again, it's anonymous, but you're welcome to fill it out and give us your thoughts and feedback. And as we move into our next webinar in the series, Program Evaluation, we look forward to you all coming back and continuing to learn with us, continuing to share with us. And I will just close again with a heartfelt thanks to this panel, and to wish you all well, wish you health. And please take back our sincere gratitude for all the work and folks that you work with, allowing us to have your time today. So we wish you all well. And again, to our viewers, all the best, and we will follow up once this webinar is posted. Thank you so much. Take care.
Thank you.